Welcome everyone to this in-depth look at pulmonary Langerhans cell histiocytosis, or PLCH. This rare lung disease can be challenging to understand, so we're going to break down everything you need to know, from its causes and symptoms to diagnosis, treatment, and the latest research. Let's start with what causes PLCH. While the exact cause remains unknown, it's strongly associated with cigarette smoking. PLCH isn't hereditary, meaning it's not passed down through families. The prevailing theory is that smoking triggers an abnormal immune response in the lungs, leading to the proliferation of Langerhans cells. Now, let's delve into the pathophysiology, or how PLCA affects the lungs. In PLCH, Langerhans cells, which are specialized immune cells normally involved in fighting infections, accumulate abnormally in the small airways and lung tissue. These cells release inflammatory substances that damage the alveolar walls, the delicate air sacs responsible for gas exchange. This damage leads to the formation of characteristic lesions called granulomas and eventually cysts and emphysema. The destruction of lung tissue impairs the lung's ability to effectively transfer oxygen into the bloodstream. PLCH is a relatively rare disease. It primarily affects young to middle-aged adults, usually between 20 and 40 years old. It affects men and women equally. Because of its strong association with smoking, the vast majority of PLC patients are current or former smokers. However, rare cases can occur in non-smokers. The signs and symptoms of PLCH can vary widely from person to person. Some individuals may have no noticeable symptoms, while others experience significant respiratory distress. Common symptoms include shortness of breath, especially with exertion, a persistent, dry cough, fatigue, chest pain, and unintentional weight loss. In some cases, PLCH can also lead to spontaneous pneumothorax, a collapsed lung, which presents with sudden, sharp chest pain and difficulty breathing. Diagnosing PLCH typically involves a combination of imaging studies, lung function tests, and, in some cases, a lung biopsy. A chest X-ray may reveal characteristic nodular or cystic lesions. High-resolution computed tomography, or HRCT, provides a more detailed view of the lung and is crucial for identifying the distribution and type of lesions. Pulmonary function tests help assess the severity of lung impairment. A definitive diagnosis often requires a lung biopsy, where a small tissue sample is examined under a microscope to identify the presence of abnormal Langerhans cells. Pulmonary Langerhans cell histiocytosis is generally considered a single disease entity, rather than having distinct subtypes or classifications. However, the severity and progression of the disease can vary significantly among individuals. The extent of lung involvement, the presence of other organ involvement, which is rare, and the response to treatment are all factors that can influence the course of the disease. The cornerstone of PLCH treatment is smoking cessation. For smokers, quitting smoking is the single most important step in managing the disease and preventing its progression. In some cases, corticosteroids or other immunosuppressant medications may be used to reduce inflammation and slow down the disease process. Bronchodilators can help open up the airways and relieve shortness of breath. Oxygen therapy may be necessary for individuals with severe lung impairment. In rare, severe cases, lung transplantation may be considered as a last resort. The primary prevention strategy for PLC is, without a doubt, avoiding cigarette smoking. For current smokers, quitting smoking is the most effective way to reduce their risk of developing PLCH. Avoiding exposure to secondhand smoke may also be beneficial. Promoting healthy lifestyle choices and raising awareness about the dangers of smoking are crucial steps in preventing this debilitating lung disease. The prognosis for PLCH is variable and depends on several factors, including the severity of the disease, the patient's smoking status, and their response to treatment. Smoking cessation is associated with a better prognosis, with many individuals experiencing stabilization or even improvement in their lung function. However, in some cases, PLCH can progress to end-stage lung disease, leading to significant disability and a reduced life expectancy. Recent research has focused on identifying biomarkers that can predict disease progression and response to treatment. Studies are also exploring the potential of targeted therapies that specifically inhibit the abnormal activity of Langerhans cells. These advances offer hope for improved outcomes for individuals with PLCH.